It was not my room. I had yesterday's room, 406. Now I have 340.
I'd like to introduce our next speaker.
So tired, so tired.
You have jet
Because
lag?
of the ancestry, I thought that Dieter should introduce our next speaker, but he's too humble for that, I guess. Okay, he's in the bathroom. Our next speaker is...
He was here waiting around for a while.
That's all right.
We weren't here.
We'll handle it. Our next speaker is a double degree, MD, DDS, and I wonder if you're going to go to law school next, Dr. Gleditsch. Are you? Okay, good. According to Dr. Klinghardt, Dr. Gleditsch is probably the foremost alternative practitioner in the country of Germany. He introduced alternative medicine to the university where he taught. And his subject for today is oral acupuncture. Dr. Gleditsch.
Chairman, dear colleagues, dear friends, thank you so very much for inviting me. I'm very glad to be here again. It's third time I came to Carmel, meeting many of you I have seen before and collaborated with you. But my special aim is and has been to come here to meet Ed Arana, my old friend. And I'm so glad that he is going on recovering. And we really hope that he still will be our pioneer in biological dentistry. Ed, you have done such a lot for us. And so many, many greetings from all German friends, especially from Dr. Kramer and all the group of biological dentistry in Germany, to you and to all the group. Thank you. So, thank you once more, and let me begin with my special subject, which is oral acupuncture, as you know, and we have talked about in earlier years here at this place. So, I'm sure we can also share some experiences you have done in the meantime and can discuss it, the problems which may have come up, or the results, I hope. So let's see what happens. You talked about me as a pope and compared me with the pope. I have to say, not all people would agree with this. And all the merits you talked about me, so I have to say, there was a very good group of pioneers in Germany. First of all, Dr. Hunecke, who had been mentioned by Professor Kuhner this morning. Second, Dr. Voll. And the third for me is Dr. Noger of France. So we have really three pioneers who will survive to the next century and longer, I'm sure. Like many, many others. And so let us see as we can agree with all what they have done for us. I was a little younger than this generation of pioneers, so for me it's so fine now to go to many places, to be invited to universities. I have been Sunday, not just a fortnight ago, to the University of Freiburg, invited by the head of the ENT clinic, 45 ENT doctors coming, and the chief of the department staying and asking and writing all the things we discussed. I think it's wonderful. I didn't believe 5 or 10 years ago that it might be possible. In January I came to the University of Dresden, the same. And in December I came to the University of Vienna, the dentist school of Vienna, Professor Slavicek. So there's really going on in Europe. And I'm very happy to tell you, we have to keep together. And we are strong, and the future is ours. These professors who invited me are very young. They're professors for about 40 years. And they said to me, we don't worry what the others say about us. We have to do what is good for our patients. And I think it's wonderful that now the younger generation in our universities really are the men we can cope with. So I'm very happy to tell you this. Now, oral acupuncture combines the very old, the ancient idea of traditional acupuncture with a new experience that acupuncture points are to be found in the oral cavity and the mucous membrane and can be used for treatment and diagnosis as well. So I have done it now in more than 25 years, and I hope some of you may have begun and did it. We will talk about how to do and how to combine it with other methods too. I will tell you in the beginning two little stories. I had a seminar some weeks ago, and a lady dentist gave me a telephone call on Monday after the seminar weekend and told me a very nice story. On Monday morning, her nurse came and said, I have a bronchitis. I went this morning to my general practitioner and he said I will be sick for about 1 or 2 weeks, and so goodbye, I leave for a fortnight. So she said, I just came from a seminar. Stay here. If you agree, would you give some little injections in the oral cavity? And we have a try. And the nurse agreed. And so in the afternoon, 5 o'clock, the nurse came back and said the general practitioner had an X-ray and he had an auscultation and he did everything and said, you are so fine, you can go on working. So I think it's a very good experience what we can do with this little oral acupoints. Another story, also a lady dentist doctor came from the seminar, and there was a man suffering from pain for about 50 years. He had been amputated both legs during the Second World War, and he had so much pain that he cried at night time. He couldn't go out of his house, and his wife came in the practice to the lady doctor, and she told her. And so she said, I will go during my lunch break and look at your husband. So she gave me a telephone call, say, Gleditsch, what do you think about which points I can use for this treatment? Oh. I say, oh, whoa, what do we do? But have a try with the points in the lower lips. And she did it. She gave 4 little injections, 4 little bubbles in the lips in front of the incisor teeth, canine teeth. The man, after 50 years of pain, first time had a relief. First time he used to take about 40 tablets, remedies every day. So he could diminish his remedies to 20. She repeated the treatment first every week. Now I met her in some weeks ago. Now she goes every month and gives another treatment. But it's going on. He now is nearly without any remedies, without any tablets, just by acupuncture treatment, performed in the oral cavity. Think of it. So they're very new experiences for us. A very similar case, it was in January last year that I was consultant in a hospital in Munich, where I live, and it was a young man of 17. He was injured by an accident, motorcycle, very seriously, and such a part of his bone in the extremity missing. So he was nearly going to be amputated. And he had so much pain that he couldn't stand near his bed. He cried just when a little, and if you give a little vibration to the bed, so they couldn't, das Bettlakenwechseln, they couldn't change the sheets. So he need a narcose for every change of the sheet. Anesthesia. He need anesthesia, general anesthesia for each change of the sheets. So I gave him acupuncture again in the oral cavity, and another very important experience in acupuncture, which you can do every day in your daily work. Instead of the side of pain, it was the left knee. I looked at the right knee, which was not so much injured. And I looked for a special place, a special spot, a very, very tiny spot, which you just can get with a needle. But there were 3-4 such spots, symmetrical to the pain side. And putting a needle there, the pain relief immediately began. So it's a symmetric rule we have to learn. We can do it as dentists every day. If there's a pain after extraction or operation of wisdom teeth with swollen, and you can't do anything on this side and you can't give injections there, but you can go to the other side, right side instead of left, or vice versa. So learn of it. It's not at any place. You have to find out the special place. But the special place is totally symmetrical. So you have to learn and to look at the precise symmetrical place and put a needle there. It's a very new experience, but in a way, the traditional teaching of acupuncture said that they used putting needles right and left at the same points. Hand points, feet points, wherever it was, right and left at the same time. I believe that our nervous system acts very symmetrically. If there is a pain on one side, the other side is suffering too. It's a question of harmony. Harmony is if both sides are in the same level, in the same harmony. But if there's an injury on one side, as if the harmony is gone and you have to try to get it back in a way. So treating the other side is a very simple way, but also a very effective way. And you can begin with this immediately. There's nothing special to learn about it, but to do. Learning by doing. This is the most important I can recommend. All what we do now in acupuncture is, on the one hand, learning the traditional system, the traditional teachings, more than 2,000 years. And the other is that we have many new experiences, such as ear acupuncture, mouth acupuncture, skull acupuncture, hand-foot acupuncture, many new systems which have been elaborated during the last 40, 50 years, no more. So I believe that in our daily work, it's 50% the traditional and 50% the new experience. We can combine both together. So the traditional teaching we have to be familiar with. Think of the many new methods, kinesiology, also neurotherapy, all the fine methods performed by an apparatus. If we have there many fine apparatus in the room nearby. So all these methods need that you learn the traditional acupuncture like we learn grammar if we learn a foreign language. It's like the grammar. We have to be familiar with the fundamental laws of acupuncture. And these laws are very simple. But we have to realize that the point is some special. We didn't realize so much about point, but more and more we came to the experience that the point is very typical, not only in its effects that can be performed, and also by the topographic. This is not Chinese. This is a writing of Het. You know Het. He did it 100 years ago. And he emphasized that in each one of the segments there are special points. He defines them as maximal points, maximum points. And he said, if you do diagnose within the segments, if you do treatment within the segments, use these points. They are primary. And we have to realize what Het and his friend McKinsey, what they really did. They were practitioners. And they used their fingers. They palpated the skin. They palpated by finger palpation and by needle dabbing. And the first they found out was when they had this fine palpation and needle dabbing, patients with herpes zoster. So this was the first way to find out the segments, with the fine borders here to there. So we have to learn that Het, as well as Mackenzie, they told us that the future of medicine might be to be very familiar with all the fine signs coming up in the outer of our organism. It's the skin. To look at the skin phenomena, to look what has changed, if there's changed the color, if there are pain, if there are special symptoms on it. So they said all diseases that are not traumatic begin with reflectoric signs. First one, a vegetative, like a little sweating. Autonomic. First, it's autonomic. Second one, functional symptoms. And third is this what we normally do in our work, structural disorders, diseases, which are very hard to overcome and to treat. So be aware that Het, as well as Mackenzie, they really struggled 30 years for a preventive medicine. Preventive medicine means look at the very early signs, the early symptoms. Look at the skin. Look at the points coming up. So you do the best for your patient. But all this was never referred in our teachings. Only the segments were referred, the dermatomes, myotomes, and all this. But I think this is a very important message. And if we compare this message with this what traditional Chinese teaching tells us, so it's the same. What traditional acupuncture did was treating in an early state of disease. What we do now in acupuncture is that patients are sent to us in our office when they have been treated in many, many other practices and many hospitals, and so now have a try with acupuncture. It's a very late state of disease, and it's very difficult to treat it. But this, what is the real idea behind acupuncture, is the early state. That's prevention. So the practitioner has to be familiar with acupuncture, not the specialist. The practitioner, the general practitioner, the dentist, we all have to be familiar with all these ideas, with all these points, and with all these findings, and to do it in our daily work. Now, we will talk about the indications of acupuncture. So let us look at some special indications. There's a functional disturbance, the first to be outlined. All functional disturbance, it may be of the respiratory system, of the digestive system, of the oral genitals, all the systems they have their first symptoms on the functional state. Pain syndromes is the most famous what is discussed in acupuncture, but only one of the many possibilities to treat pain syndromes. So very important, the treatment of disorders of the musculoskeletal system. Again, we can do a lot if we begin in an early state. Many problems with the TMG had to be treated much, much earlier than we do now. And we will talk about a lot in the seminar, what we can do by acupuncture treatment. So all what is discussed in acupuncture is the regulating of harmony of the energetic level. Energetic, it's difficult to define, to explain what it is. In ancient teaching is the Qi. Qi Ku I. Ku I. It's not to be translated. It's a vital energy. It's not only the physical, but another energy too. But when we do our work in acupuncture, we more and more realize how important is the model of the thinking, even if it's not to be explained scientifically. So the autonomous symptoms, again, the psychosomatic disorders, so just the most important indications for acupuncture treatments. But think of that also in addictions, even in drug addiction. There are now many important programs going all over the world, beginning in New York with Michael Smith. You may have heard about it. And now we began in Europe 5-4 years ago with the same programs, using 5 points in the earlobe, right and left, and it is a very good result. So we can get help. It is an additional treatment in drug addiction treatment, but it's really very helpful. So the endocrinium as well as the immune system react well on acupuncture treatment. I will tell about later on with some studies on it. Now, this is special in our field. For example, in parodontopathia, but you may think the same as with TMG. Relaxing the TMG, relaxing the muscles of mastication. Things very important. And to do this, it's very important to know points that can be used for this. I will tell you a very simple example. Relaxing of our muscles of mastication. We think of masseter, of temporalis, of pterygoid muscles, but we never think of the muscles of the mouth bottom, which is biventer, hyoid muscles, all this which is here, very important even for tugging, chewing, and for the normal articulation. There are points. This is a picture of a book of Simon Stravell, trigger points, myofascial pain syndromes. You see the little cross, the black cross, is a trigger point. Does it work here? Yeah. You see the trigger points. Trigger points here, trigger points there. But the pain patient suffers is here, at quite another place, or here in the incisor teeth area. What to do? You can't put a needle here. You can give an injection at this place. So we have learned that there are special reflectoric points that can be used for treatment. If you call it trigger points, as to be seen here, or if you call it for acupuncture points, it's the same experience. This point that we will learn together how to use it is here in the cranial part of the sternum. If you really hit this point with a needle, all the tension in this part, in all these muscles on the bottom of the mandibular is dissolved, all the tension. So it's a very simple method, but it might be included in all treatments in dentistry. Not only in problems with TMG, but also for normal prosthetic work. Yes, in the midline.
Would you mind showing the point? I take my finger.
Yes, we can do it. Yes, D3 is wonderful. Very practical. This point is situated in the cranial part of the sternum. If I have a little finger palpation here. Here. Did you see it? This was his point. You have felt the reaction. It's a very important point here. Sitting in the midline, and you can feel it. I don't feel with the fingertip, but with the finger edge. With the side of the finger. So just go with the finger a little up and down. Here it is. Okay, you see the action. Give a needle at this place, and all the tension is changed. It's very simple.
Can you just apply pressure? Will that work, or do you have to place a needle in?
To put the needle in is much better. To place the needle as correctly as possible. I will tell you and I will demonstrate it later on. So just to tell you, there's some very simple methods, but they have to be included in dentistry for each prosthetic work, for each TMG work. I think it's very important to do it. And also in kinesiology, you will see it changes the testing if you do this point. Now we can take back the other one, which we had before, dentistry. Now, some more ideas for dentists. Regulating the functional interplay of correlating mucous membranes. What is it? So, let us think of general acupuncture teaching. There are special points. For example, there are points at the hand, a very important point. One of my most interesting experiences in acupuncture was 20 years ago when I came to Vienna, and at the polyclinic of Vienna, tonsillectomies were performed just by 4 needles. Needle sticking here, this point, another needle here at the thumb, outside, near the nail, this point here, this one. And patients sitting between 2 little tables, 2 needles at each side, and we had no electrical apparatus at that time. So the needles were manipulated here by hands. 2 anesthetist doctors did it. And one had to go to another operation, so they put me there, do it. And I did it all the morning, doing 5 tonsillectomies. All 5 patients had no local anesthetic. They had no pre-medication. They had nothing. Just 4 needles manipulated by hands. The operations were without any pain. There was no vomiting. There was no problem with the circulation. Patients were total fine and a mini bleeding under operation. So I learned that acupuncture is wonderful and can be used in our fields. So still, these points will be very helpful for us, using them for pain syndromes in dentistry, in ENT, and so on. For trigeminous, for orofacial pain syndromes, we can use this point. This other point I talked about, I can give you another. It's a point number 11. This point. Take it. Other way, other way. Yes, this point. This point was told by old Chinese teaching to be needled in case of acute tonsillitis, pharyngitis, pain, acute pain syndromes in the throat. So I put my needle there with some patients, and
Name the point.
it's number 11 of the lung meridian, this point. But forget it. I just tell a story. I put my needles there, and old Chinese teaching says you have to do it with a very a Dreikant needle. What is it? Dreikantnadel.
Triangular shaped
A very,
needle.
very hard needle and a thickness. Yeah. So I did it with some patients, but
Thick needle.
a thick needle. But patients didn't come for more treatment to me. So we can't do all what Chinese did in former times. Later on I learned the same can be done at quite another place. It's here. It can be done at the place about here, this area. But you have to palpate very exactly and to find out the area where the most pain is to be felt. And there you need not stick a needle, but just have a little striking with a needle, with a very sharp needle over the skin, and just that a little bleeding comes up. And as soon as the bleeding comes up, in 80% the pain is gone. Not the inflammation. The inflammation is still there, but the pain is gone. I have used this method sometimes for myself when traveling around for seminars, and I awaked in the morning with very hard pain in my throat and I couldn't speak. So I gave me treatment at these places. I was fine all the day, but in the evening and next morning I felt my inflammation still in my throat, but I did the same and it worked again next day. So you can help you, and you can, it's like a pain-killing method. And it helps, for we know that this area in the hand region, this area around the elbow, is an immune active area. And very simple to be treated here in this area with needles, or treating children, you can do it by a soft laser method. So do it here. But it was still the question of functional correlated systems and organs. If we look at this line, so we see that there are many, many points lined up so that even if only the points would be to be seen and not a line between them, we would imagine that all this is a system. It's a line. It's correlated with one another. So Chinese realized all these points when they were lined up as a system of its own, and that this system is correlated to special inner systems, functions and organs. And for example, this system here is a system of large intestine. Why? You can ask, why have we a system of large intestine situated at the hand and at the upper extremity? But now we learned that all these points, especially this point in the hand and arm region, they are active for regulating mucous membranes, but not only of the large intestine, as well mucous membranes in our field, in the oral cavity, in the nose, and in the sinuses. So a very new experience was that points, for example, on such a line, regulating two systems far away from one another, in the oral cavity and in the bowels. So in modern immunology. We have learned in modern immunology, we have learned that there are two different systems. The one is connected with the mucous membranes in this region we call Waldeyer. Waldeyer?
The ring of Waldeyer.
Waldeyer, or the bronchus-associated system. And the other is the bowels or associated. And both together now are MALTs, the mucosa-associated systems or tissues. So in modern immunology, they have the same, that the mucous membranes of the upper part of the body, especially in our field, and the mucous membranes in the bowels, that they are very near correlated to one another functionally. And this is, if we have back the, yes, this is what we talk about, regulating the functional interplay of correlated mucous membranes. For me as ENT doctor, it was very important to learn I can't treat sinusitis troubles without treating troubles of the intestines as well. I can cure nearly all cases of sinusitis without operating, but I have to do it in this functional interplay between the mucous membranes of the upper part of the body, in the nose, in the sinuses, in the throat, and in the intestines. Not only the large intestines, can also be the small intestine, but it's the intestine. So regulating the functional interplay of correlating mucous membranes. And this is the same for parodontopaths. So one thing we have to think of are bacteria, virus, all that what we learned. But the other is that we are depending on our mucous membranes. We know it in immunology because we talk about the psycho-neuroimmunology. Neuroimmunology. So psycho, that means it depends on the functional state of our mucous membranes. The functional state of our mucous membranes is so important that a professor, chief of the department of ENT at Bonn University, some years ago at an ENT congress stated this: in acute sinusitis, in initial state of the catarrhal inflammation, the secretion fluid is sterile up to 70%. Do you understand what it means? It means that not the outer factors, the bacteria, is it what makes us suffer, but first our mucous membrane, our immune system, is not on the real state, on the best. So that the bacteria which stay with us, they become virulent. And so next day or third day, there are the bacteria, and so we can treat with antibiotics, but not at the first 2 days. There's no idea. In so many cases, 70%. And that's university. So it's the same with the parodontopathia. In acute states of inflammation of our mucous membranes, they have to think of that in many, many cases there's another cause but just bacteria, just viruses. At first, our immune system, it's the state of our mucous membrane, and it's the state of our psyche. Now, the third point we have to go on with the, yes, thanks, you do it wonderful. Now, harmonizing the general psycho-vegetative state. This is the same what we talked about just now. But what can we do as dentists for this? A very simple way is to give injections in the oral cavity near the wisdom teeth, especially of the upper wisdom teeth. We have learned that this works very well in harmonizing the general autonomous state and can give a much better balance. So you will learn it, and many of you have done it before, so it's a very simple way to do this. So first of all, TMG, relaxing the regulating of the mucous membrane and harmonizing the autonomous nervous system, and by this harmonizing of the psyche as well. Now we have the next one of the this one. Yeah, we can do it. If we talk about the indications of acupuncture, this is a lady doctor of Vienna. She came to many places, and she also treats handicapped children with acupuncture. And think of Dr. Yamamoto of Japan. I'd like to take Ed to Yamamoto, to Japan. Yamamoto is very famous. He developed the skull acupuncture. And I came to this place in Japan, and we will have a congress in October at this place. In October, it's an island in the south of Japan. It's an international acupuncture congress, and Yamamoto told me that about 200 dentists in Japan are now going on being interested in biological dentistry, and we may go there teaching them. So it would be nice to have many of you with me to help to convince Japanese dentists. So Yamamoto treats especially all patients with apoplex, paraplegia by skull acupuncture. And he has the best results ever found. He is invited here to the States, invited to Europe, to many, many places, because it's the only method we now have without some stroke treatment. So handicapped children, this is a laser machine, or stroke patients can be treated just fine also by acupuncture. But what we have to learn, it's as well for this is what Yamamoto does with skull acupuncture, as well what I told about additional treatment with drug addiction. Treating every day. And this is a problem also for us in Germany. We have no doctors who have time to treat patients every day. Drug addiction people have to be every day. Stroke patients have to be treated every day. This gives the best results. So I think we're finished now with it.
Some warnings.
Some warnings, yes, put it on. So if we talk about acupuncture and all the fine indications and possibilities in treating people. So this is a very, very important that we only do apply acupuncture after we have done a Western diagnosis. I believe it's the same in the States here as it is in Europe, that many laymen do acupuncture. And last year, a patient died in Norway after had been acupunctured here in the sternum area. You know, sometimes there is a very, very fine hole in the sternum. And this layman puts the needle deeper and deeper because there was no resistance. And so you can imagine what happened. So we have to be familiar with anatomy. And so only medical doctors, dentists, veterinarians might be allowed to do acupuncture. For anatomy is the first we have to learn about to be good acupuncturists. So again, no vertical needle insertion in upper thorax area because of the danger of a pneumothorax. It's clear. Now we talk about the acupoints. The acupoints are special points. And I'm sure that's not only for the acupoints, but as well for the trigger points and the maximum points of head. For all these points have a low electrical impedance, a lower electrical resistance, and therefore a higher conductivity. Increased tenderness, you can feel it, painful, and the skin temperature is increased just in the area of the point. Number 4, F4. So, all acupuncture points, we didn't know what it is, the morphology, the anatomy, the histology of an acupuncture point. So about 9-10 years ago, anatomy professor of Germany, Heine, he found out that in many cases it is a site of penetration, perforation by a vascular nerve bundle, penetrating the superficial fascia, just to go out to innervate the superficial layer of the skin. And this fine vascular nerve bundle is surrounded by connective tissue, very weak tissue. So if you go in with a needle at these special sites, it's very weak. It's a lower resistance for the needle. And Chinese doctors never talked about points. They talked about acuforamina, openings. So really these acupuncture points may be in many cases be kind of openings. It's the same in the oral cavity. As it was to be seen before, we can find out the points by electrical detection, because the electrical conductivity is changed at this point. But we can't do it in the oral cavity. There's a problem because of the moisture in the mouth. So we have to find out other ways. So we have a last one. Now then we change and have our slides. Just this one. In many cases, our trigger points and head maximum points, also the motor points, are identical with acupuncture points. So wherever we find out points, they have the special abilities. And to find out points, we need our fingers. I've done my work in the university pain clinic at Munich University for 10 years as a consultant, going there every Tuesday without any honorar. And I learned a lot by this. But on the other hand, we had seen that acupuncture can be very, very helpful, and that trigger point therapy has changed pain therapy, because therapists, pain therapists, they need their fingers for palpation, which they didn't do it before. Before they had just the injections at the places to burn cervical spines, thoracic spine, but now they need the fingers to find out the trigger points. And a study of Melzack, the famous neurophysiologist Melzack, who found out the gate control together with Wall, he stated in a study that about 70% of the trigger points are at the same spot, topographically at the same spot as acupuncture points according to the traditional teaching. So again, we have the same experience. So we can like this. And have some slides, please. If there are some questions, please. I hope you can see it without to have it dark in the room. What you see is a superficial fascia. It's no microscopic picture, but eine Lupe, what's in
Just an amplifying glass.
an amplifying glass. It's just an amplifying glass, and this is a fascia. And here is a place of penetrating the fascia by this bundle of nerve and vascular bundle, just penetrating here, and this is a fine weak connective tissue surrounding the bundle. Now, a very important acupoint for dentists, and same for ENT doctors. It's a point under the lip, in the midline between lip and chin. Point against Würgereiz. Würgereiz.
Oh,
Vomiting.
choking reflex.
Choking reflex. Yeah. I'm sure that many of you know this point. Who has used this point? Very few of you. So we will train and use this point in the seminar. I came to the Munich dentist school in December, and one of the professors invited me, and he said all his doctors and professors and may come, and I had 2 hours teaching, and then there was very critical doctors, and so the professor said to me, please demonstrate. So I asked who is very sensitive here in choking. Gagging. In gagging reflex. So the professor himself was it. And I put him a needle there, and then I put my instrument deep to his uvula, and there was nothing reaction more. So he was a very good man. He stood up and said, now I believe in acupuncture. It's the same moment. He stood up and said, now I believe in acupuncture. I have never had this feeling that anyone could do it in my mouth, just with such a little needle. So I believe that we can convince the university people much more by our doing than by studies, research work. For this is immediately convincing. So once more, but we can give a demonstration just now if you like. That is, yeah, we can.
Would that be effective with just pressure? Finger
Yes.
pressure?
The question is if needle insertion is necessary or if we can do it in another way. For children, for example, we can use such a little instrument. I have such an instrument with me. A little Amalgamstopfer, we say.
Amalgam condenser.
It's a special acupuncture instrument that you use for like the ear acupuncture.
Yes, but you can use whatever you like. It can be any instrument of your normal use, which you can press against this point and give a little pressure by an instrument.
A metal probe.
A metal probe, whatever. You can do it with a pen. It works. So just give a little pressure, but better is to use a needle, especially with grown-up people.
If you're using pressure, does that pressure need to be maintained during the process, or will there be a memory?
Yeah. So it just helps for 2 minutes maybe, and then it diminishes in the effect. But you can strengthen the effect just by giving little impulses to the needle. Very fine vibrating impulses. So you have 2-3 more minutes. If you, for example, have another Abdruck, another impression as dentist. If you need this point for impression, you can do it just by manipulating the needle. So we have a little demonstration if you like it. Who will come here?
I want this point.
But we can be. Who has problem with gagging?
Bob, you're gagging. I remember.
No, not at all.
I remember.
How do you determine the point exactly? Do you test the tenderness in that area, in that general area?
Coming up? Fine. Thanks. We but we need a stool.
The stool?
To sit down.
I'll need
Oh, I have no needles here. So we do later.
No
So we do it after the break, okay? We do it after the break. I have 3 minutes. Here I have it.
Does that help if you're injecting the tonsils too?
just to, but sit down. Can you see it? I think it's fine to be seen. It's the midline. It's
But I have a long chin.
yeah. But look in front of the side. It's the deepest impression between the chin and the lip. It may be here. You see it? And if I have my needle in this area, I can just do a little. Here you feel it. It's very weak. So now I can put in the opening here at any place.
Do let me have
So I cannot do upset.
Yeah, but my gagging area is beside of my tongue on the lower. I'm still gagging, not in the throat area, on the tongue.
On the tongue.
Is that good for doing?
The
that
tongue though.
point could be good for doing tonsillectomies.
But it's so. I can't do it from the other side, you understand? I must see my patient from the front side. So here. Now it's fine. Other side?
Well, it's better, but my gagging is not the throat, like when I take a lower impression, okay? Like by the tongue, that's where it really drives me crazy. Try
So
it
fine.
again.
We have a fine, difficult patient. It's very good to learn. So if it's not enough either, we can have a little impulse here again. So you see here, okay? Yeah. And if it doesn't work enough, we have another point in the ear. I can stick another needle here in the ear area, 0 point. So I can verstärken, improve, increase the effect. But I think maybe still working. Okay. Still working. Okay. Thanks that you came.
Thank you.
Show the spot on the ear.
How do you feel?
Good.
The pain here.
It's gone through my. It's like
No, how was the pain?
a little bit, not much.
A little bit.
Yeah.
So, but look at the point. Thanks for coming. I did it with the smallest needle to be found. It's a Japanese.
Half-inch?
Look here.
How deep did you go in?
You can look at it.
You can use a half-inch 30 gauge injection needle to do this.
You go all the way in?
No, half
No,
way.
half the way.
Quarter inch in?
Yeah.
Oh, good. But we have our demonstrations after break, and so we will see it better. Many, I have to say to you that in Germany, the dentist board,
Yeah.
we have
Dental board.
the dental board, we have many dental boards for each of our country, our states. We have, how many have we? 14. 14 states. So we have 14 dental boards. And 9 of them invited me to demonstrate all these acupuncture possibilities for the dentists. 9 of 15 in Germany. So you see, the dental board is very open for these new experiences. For example, pain therapy by acupuncture and so on. I'm sure, in my opinion, we might build up an international group, as Edrana did from the beginning, and collect all dentists from all over the world. It would be very, very strong power behind us if we have any problems with authorities. If we can say, yes, it's in Europe, in Austria, in Switzerland, in Germany, they do the same. If we are a little group of 50, 60 in each country, we are nothing. But if we are some thousands, Japanese, Chinese, European, here from your states, so I think we would be much more power in any struggling with authorities, universities, whatever it is. So, yeah. So we go on with the, thanks. We go on with the slide. Thanks. Now, we talked about trigger points. You see, it's not acupuncture, but we use the same points in acupuncture, which now here are named and defined as trigger points. There's another point, just in the overlip, between nace and overlip. And this point is a collapse point, a reanimation point. You can use this point whenever it's necessary in your office with any patients, fainting. Yes. And it's very simple again. You can use any sharp instrument, any sharp instrument. You can use any sharp instrument, whatever it is. You can take a pencil. You can have your fingernail. Some months ago, I was on a plane flying to any place, and the captain asked, "Is there a doctor? Please come very quickly." And so I went, and the stewardess led me to a person who was collapsing. And what to do in this moment? Giving mouth breathing or whatever. So I first put my fingernail on this point, and patient come up in some seconds, opening his shirt and laying up the feet, and some very simple done. And after 2 minutes, I went back to my place and all looked what I've done. It's so simple, just if you know this point. In the military, this point now is induced in many countries. I had lectures with the military doctors in January in Germany. They are very interested in these acute points that can be used also in catastrophe situations. If there's an earthquake or anything, you have nothing. You have no injections. It has nothing to do with the patient, but you have your fingers.
I'd like to share a little story on this
Yeah.
point.
Yep.
I listened to his lecture in Germany, and that was in November in Medicine Week. And I came home to Santa Fe when I lived in Santa Fe, and we had snow already, early snow, and I went skiing that day. And I attended a political meeting that night, and next to me was a very quite obese lady who started there was an open fire somewhere, and she started kind of wheezing. And so she went out, and I kind of pretended like I usually do that I'm not a doctor and I don't know anything. And and I heard the sounds outside in the snow, and suddenly the sound stopped. And people started rushing out. There was a feeling of panic, and I said, "Oh shit!" Yeah. So I kind of went outside. There was this lady lying on the ground, blue, not breathing. She was in respiratory failure, heart failure. She was gone. I mean, she was died of an obvious asthma attack. And it was in the time when I was single, and the suspender of my skiing pants was attached to the skiing pants with the safety pin instead of, properly. And looking for the sharp object, I kind of looked around, kind of what I could use, and I saw my suspender and ripped out the needle and kind of drilled it in the point. And was wishing as I was drilling it into it, and she inflated, and within 2 or 3 minutes she was back to life, and she would have certainly died. And so I just going to share it with you that you saved at least one life that I can testify to.
Thanks. Thanks. Thanks.
Dietrich, did you put the pin back or did your pants fall down?
I was skiing with my friend Ara this last week, and I packed my same skiing pants, just like 8 years later. And he looked at my skiing pants and he said, "I'm not going skiing with you with these pants." And he gave me a whole new suit to wear, but the pen is still in those pants.
Okay. Now, okay. Very simple point. In the midline between nose and overlip.
Oh yeah.
Yeah, I put it here. Thanks. Now, two other pictures. We call it the tail thermography. A patient with a sinusitis had been treated with 2 needles, and the needles had been stuck in the lumbar region. In this level here. It's the level of the hip. And after 4 minutes, you see this change. 4 minutes later, 2 needles stuck in sinusitis treatment. And points that had been treated are points of the large intestine. Again, this connected tissues, as we talked about. Acupuncture science, all functionally linked organs. They're linked as in a network. Cell becomes a complete group of organs and functions linked together, which I talked about. Now again, these points, we have talked about this point here. You remember, points in this area. And I told you this story here of this area in acute pain in the tonsils or pharynx, that you need not insert the needle, but just have a little scrubbing here, a little bleeding, and as the blood comes up. So in most cases the pain is diminished or gone. Very simple method, and it doesn't hurt so much, and the patient tolerates much better. And then we do it here in the thumb area. Again, something about trigger points. Here you see the trigger points in the masticulatory muscles, masseter muscles, and so on. Again, the experience that the pain patient is suffering is not at the same area. This pain area is a red area here. It can be in many places in the front area. Many patients now suffer from such diseases. They come to our office with pain in the ear region or pain in the sinus region. And if we have an X-ray, and if we have an inspection, we don't find anything. Pain is caused by myofascial pain syndromes, trigger points, taut bands. And so we have to learn that the trigger point, that means it triggers off. The trigger point and the area of pain are not identical. And this is the same rule in acupuncture, that we can treat by remote points. By remote points. I can treat headache by points at the hands, by points at the feet, and other remote areas. I just demonstrated this here to clear up that the same experience now is valid in trigger point experience. Now, if you, for 10 minutes, we will tell a little about what is going on in the scientific research about acupuncture. We know a lot, not everything, but we know a lot because of the pain research of the last 25 years. So if there is an impetus, it's a periphery, it's a skin point, it is on the efferent way to the spine, and at several levels of this central nervous system, the pain can be modulated. Can be modulated at the level of the spine, of the midbrain and the cerebrum. Then on the efferent way, again, there are pain modulations going on. And what happens is that endorphins are activated. Endorphins that are opium-like substances activated and produced from the body itself. So at many places pain relief can be produced, but it works with some patients fine, and with other patients it doesn't work. And we will talk about this phenomenon later on. Now, I will tell you about a study we had performed. I think it's here or there. Yeah, I have it here. A study we have performed at the Munich University during the last 2-3 years. here you see the very simple model on it. Yeah, okay, you see it. It's a very big screen. And the patient has a lamp on his head, like we use it as an ENT doctor, and it's going on the measurement of the movement of the cervical spine. So the study was regarding the movement and the pain syndromes of cervical spines. And the movement can be registered in the scale, to the right, the left, up and down and so on. Patient, after this measurement, left for another room, had a treatment, either it was blinded, either the real treatment or placebo, and returned to the same screen after 5 minutes, and another measurement had to be performed, and the results were very thrilling. One of these seemed to be seen here. Oh yes, it's okay. You see 3 groups. First group is acupuncture, and that means remote points. Think of it, it was a cervical spine, but we didn't touch the cervical spine by a needle. We used points in the earlobe, we used points at the 5th finger of the hand, and we used point at the wisdom's tooth in the lower jaw. Just this were the best results, before, after, before, after, before, after. In all groups, this is the best results. We didn't touch the cervical spine. All remote points. Placebo, little, little, nearly nothing, nothing, nearly nothing again. So you see the big difference. The real acupuncture with the remote points with fine effects could be get here. So the other group is a dry needle technique. This is local points, local intracutaneous stimulating with very long needle. It was developed by a Canadian doctor, Shen Gunn, from Vancouver. He is a consultant in the Seattle Pain Clinic, and he has developed a dry needle technique, which is same as acupuncture, you understand. If you don't talk about acupuncture, you can talk about dry needle. It's the same. It means no more injections, because pain treatment before had been done with injections of local anesthetics. Instead of local anesthetic, he just used only needles, and therefore dry needles. But this gives a strong pain under treatment, and this goes on for some hours. Therefore, the result is not so good in the beginning, but after maybe 1 day later, it's the same result as in the left group. Muskelkater, what's that? Muscle aches are produced by this here. So, but this what we can learn here is that the best we can do is just not treat at the site of pain, but learn to use remote points. And this is the same with TMG. I will tell you of points to treat TMG by remote points. Yep.
Have you ever tried, I'm sure you tried the acupuncture points without and then with anesthetic?
Yes.
Anesthetic. Do you
I
find
have to tell you that
I find a huge difference in that myself.
it depends on. I have used local anesthetics in about 40 years. This morning, Professor Kühner told about neurotherapy according to Hunecke. And I'm a pupil of Hunecke since 40 years. So I did everything with local anesthetics too. But the year when I came to the experience of acupuncture, I just needled for many years. And then I took, instead of needles, local anesthetic. And another year I took, instead of local anesthetic, natrium saline solution in the oral cavity. Sodium. Sodium chloride. So you get good effects with all 3 methods. With a pure needle, with local anesthetic, but also with saline. What to do? But in special points, especially these remote points I told you just now, the needle is better, I'm sure. This is another result of the same study. Okay. Now, once more about the neurophysiological ideas in acupuncture. Two very important things. Activation of inhibiting neurons, a nociceptive mechanism. I've only talked about nociception. That's true. Our neurons, our nerves are able for nociception, but they're also nociceptive mechanism. And the other is what we talked about, the endorphins, central, humorally affected. That means in the liquid, in the brain and the central nervous system. This is going on and transported endorphins, beta endorphin, and many other fine such pain modulating substances. Okay. Questions?
It's fairly easy to block the effect of endorphins by administering naloxone or naltrexone.
Yes. Thanks for this. Naloxone is a substance that can block the effects of endorphins. And by this, Pomeranz of Canada and Han Yushen of Peking and other of the famous researchmen in pain research, they could prove that endorphins had been working, because in the same moment when naloxone was injected, the effect was gone. Was it? You understood? Okay.
The question, if I could lead on for a moment, the question is, what's happening with number one? In other words, naloxone would take care of the central effect. Is there some other effect, such as the peripheral effect that you mentioned here, that acupuncture is performing irrespective of being modulated by endorphins?
It depends on. The most important may be that acupuncture only works when the nervous system is intact, in the area where the effects are to be produced. If the nervous system is blocked, or if there is a
Blocked regulation.
Yeah, so there's a blocked regulation, and you can't affect any effects with acupuncture. So you need intact nervous system. Okay. I think I'll tell a little more about it. Now we have some more slides. Here we'll This was a study I talked about. Okay. The same, the pain during movement, the same as we talked about before. The left group again, remote points with the best results in all groups. This study has been awarded with a prize at the Munich University. This is in German, excuse me, but it's a study of the University of Heidelberg, published in last year. They're asthma patients, allergic asthma, 38 patients. And this study was very interesting because they could get from that, they had in their results changes in the lymphocyte subpopulations. The subpopulations, interleukine, they had changed. And this is very important, that acupuncture changes and gives good results in the immune system. If you use the best points, for in this study you see it was a Chinese doctor included. She was at the pain clinic at the Heidelberg University, and she was the person who with each treatment chose the points and said we treat with this points or that points. So you we need very experienced doctors for such studies. It's not possible that we can do the same treatment for each patient. We have to have individual point choice for each kind of treatment of each patient. Another is therapy of the rhinopathia pollinosa with acupuncture. This is a study which had begun 1988 at the University of Dresden, Heidelberg.
That's hay fever.
Hay fever. And this is going on now. They have now about 500 patients. This was a result in the beginning, but now they have about 500 patients just treated at the university with acupuncture and laser acupuncture, and same good results, you see. I think very important that universities use these methods and that is good documented what is going on with acupuncture. Also that they compared the real acupuncture, the needle acupuncture with the helium neon laser acupuncture and the placebo acupuncture, 3 groups. Now we talk about a phenomenon which is very important for us to understand, that we have special areas in the body. For example, this is the earlobe. The earlobe full of points, plenty of points in the earlobe, plenty of points in the nose. It's the outer side of the nose, right and left. We call it for a homunculus. You know what it is, homunculus. And again, homunculus in the foot area. So many homunculus all over the body, and we call it a somatotrophy or a microsystem of acupuncture. We didn't know about this phenomenon up to 1950. 1950, Dr. Noguet of France was a man who first found out that in the earlobe, special points are to be found suitable for treatment of lumbalgia, ischialgia, and cervical spine troubles, and so on. And so he found out more and more points, and that all functions of all our organs can be treated by points correlated in the earlobe, correlated with all these functions in inner organs. So we have a cartography. We have a system of points in many special areas of the organism, for example, the earlobe, the nose, and the hand, the foot, the back, many such microsystems. And one of these microsystems is to be found in the oral cavity. This is very well known, the earlobe, which can be demonstrated as an embryo upside down. For the head region is projected down, and the musculoskeletal system is projected in the upper parts, and the inner organs are projected in the concha area. Just very quickly. And here is the ear of an animal. You see the same points here, for example, kidney points, pancreas points, and liver point. Normally, all these points are electrically neutral. You can't find these points by detection. But if there is a stimulation, or if there is any functional disturbance in one of these areas, in one of these organs, for example, if there is functional disturbance in the liver, this point would change the electrical behavior. So you can detect the point after this irritation had been done. And if the irritation is gone, this point neutralizes again and is no more detectable. So by this research work, especially of Russian people, Portnov and Duryan and others, we are sure that all these points are very precisely detectable. Just the ear lobe once more with the musculoskeletal system, with the spine, cervical spine, thoracic spine, lumbar spine. Here was the first area where Noguet of France treated a patient who told him that he had been treated in Indochina, in Vietnam, many years ago by an Asiatic doctor at this area. And so he put a needle at this place, and at the same moment the lumbalgia had gone. the inner organs. You see the stomach, the bowels, you see the liver areas, the lung areas, inner organs projected in the concha and the deeper area of the earlobe. Now, this is the skull area according to Yamamoto of Japan. He found out this area now 15 years ago, and very successful treatment here of many, many diseases of stomach, of lung, of circulation, liver again, heart, and many other systems are to be correlated with these areas in the temporal bone area. And this again is the area of the dentists, for it's a muscle for mastication. So think of it, that all these points are very depending on a very roughly chewing. If we have no good chewing, these points are not activated. So activating these points is also energizing the body's systems. The systems of the spleen, of the small intestine, of the stomach, and so on, they can be energized and activated just by a rough chewing. Same inside the mouth. There's a nose acupuncture with points outside the nose. I will tell you a little more about this tomorrow. Just here inside the nose. 100 years ago, a professor of Berlin, he found out that in the nose inside, Muscheln, in the muscle, in the concha, you find special places for treatment, for example, for asthma or bronchitis, or other places for treating cervical spine troubles, or treating digestive disorders. Just special points in the concha endonasal areas. But now we come to the oral cavity. Many, many points are to be found in the oral cavity. We didn't realize it before. You only can get aware when you palpate the oral cavity, and we will do it later on, that we can, by palpating, find out there's a painful area on the left but not on the right, but or in the upper jaw but not in the lower, and so you can just compare by palpating the painful areas. But what it is, the area we tell later on, for example, in this place. This is a canine tooth, and the place which is connected with the canine tooth, this special site, is situated in the lip area, not in the sulcus. You see it's more labially outside here. And if you palpate, and it can be painful here in this area, you can treat this point, this very point outside the canine tooth. But it can also be another point outside the incisor teeth. It would be situated here in the lip area. So you find points in the lip area, and if you go on, you find point here near the sulcus in the premolar and molar areas. So we have to be aware there are lots of points in the neighborhood adjacent to our teeth. And these points can be used by dentists for many, many good work. Once more, points in the oral cavity, labiodentally and buccodentally, surrounding the vestibulum of the oral cavity, about 1 point situated out of the tooth, in the lip and the cheek area. This point, for example, many of you have experienced this. You know which is the correlation of it? Who has experienced it? You know it? Yes. Some more you know it. This is connected to canine tooth. Is the only one which in a way has a aggressive form. Is it? It's the only one. And the canine tooth is connected with liver gallbladder. And I think it fits. For liver gallbladder is a very dynamic and little aggressive with all the connective attributes we find in the gallbladder system. So if you think of it, it fits very well with the canine tooth, and you can treat here not only diseases of liver and gallbladder, but also of all this what is connected with the system. And this is especially the hip and the knee. So hip and knee disorders, pain conditions, we treat by this point here. I have to tell you that all these intercorrelations between the teeth and the inner organs, these had been elaborated by Dr. Voll and by Dr. Kramer. These are really the pioneers of acupuncture in our time. And they did a very good work. Dr. Voll, you know, his machine and his kind of measurement. So he was active and did his measurements during Dr. Kramer, as a dentist, had his boring and sliping here one or the other teeth. And so they elaborated that sliping and boring at the front teeth, at the incisor teeth, just gives a change in the change in the meridians of kidney and bladder meridian, but not any of the other meridians of acupuncture. So only these two meridians they changed when sliping, boring the teeth. And when sliping, boring the teeth, the canine tooth, only liver and gallbladder was changed. So by this, they put up a system of correlation between teeth and the inner organs according to the system of the meridians of acupuncture. And this is valid now since about 40 years. We use the system in a very long time. And it has been bestätigt, it has been confirmed, reconfirmed in many, many experiences by many doctors all over the world. Just for us who are not familiar with the system have to learn that these points are situated in the lip area. Here again in the lip area, the points. Here again, this is a tooth, and in the front area, here the point is situated here. In the premolar area, it's much nearer to the sulcus, and in the molar area you have to palpate the alveolar bone to find out the point area. Palpating best is done in the front and canine area with one finger inside, one finger outside, so that you have a little pressure between your fingers and you can palpate the area which is painful and pressure. Now, the injection is very simple to be done in the lip area, and it's clear that we can't put needles and have sitting needles in the mouth, so we do it by injection. Injection with a local anesthetic, injection with saline, injection with homeopathic remedies, whatever you like to do if it's a biological and neutral solution. Now, very important, the area at the end of the alveolar processus. This is a tuber maxillae. And in this area of the tuber, many, many points are to be found. It's very, very painful and pressure in many of our patients if you palpate here. It's the surrounding of the wisdom tooth. Dr. Voll and his group of electroacupuncturists, they call this area here the nine-tooth area, the area distally of the wisdom tooth. So nine-tooth area, that means this little end of the alveolar processes in the upper and in the lower jaw. I will demonstrate it in the lower jaw. This is here to be seen. This area. The 9 tooth area. The wisdom tooth here, the upper wisdom tooth, the lower wisdom tooth, and so this is the 9 tooth area. Back once more. So this area is very important for many, many treatments. I've seen that each case of sinusitis is painful when palpating this area. Not only sinusitis, but bronchitis, every kind of infection in the nose and in the oral cavity. You have a painful area in the mucous membrane surrounding the wisdom tooth, or the 9 tooth area here. How to be treated? I think it's very simple. Either you can have the mouth open like here, and you will find the area by palpating first with your finger, and then you go on either with another instrument, but I have found it's best to detect the point directly with a needle. This is a needle dabbing method. That means you have to be very, very careful when you use the needle as a detection instrument. So you have to differentiate. The needle in the first step is a detection instrument and used very, very softly, carefully. And then if you have found the point, if you stuck the point, then you can have the normal insertion of needle. But in the first step, you have to be very, very softly and careful with your needle. The best doctors learning this method are the dentists, because they are very familiar with a supported hand. Normal doctors, they are not familiar to support the hand when sticking a needle. Supporting a hand, that means that I have the needle, as I have my hand supported at an area nearby where I use my treatment, as we do it with a bore instrument. So the supported hand is very important to do this.
Where are you at there? Are you on the tuberosity exactly?
Once more.
Outside?
There are several points, beginning in the area buccally. I can't, you think it's going on, here's this area buccally. But the points are situated also distally. On the tuber, it can be a little palatinal. It would be this area too. But not only in sinusitis, but in all kinds of problems with the mucous membranes. Think of what we talked about, the large intestine, if you remember, that we talked about that the large intestine is connected not only with the large intestine, but with all membranes also in the oral cavity and in the nose and sinuses. And the same is here with this area. So we can use this area for all kinds of treatment of the mucous membranes in our field. We can treat this area in all immune ill conditions in our field.
Jochen, say something about the depth of just submucous.
Yeah. If we have injection done at these areas, the injection has to be done very superficially. We only give some few drops at every point, and maybe 2-3 drops, no more. So please be very careful when you do your injections. You need not inject deeper than for the results are better with a very superficially injection. We have learned that not only sinuses and mucous membranes can be treated by this area, but also shoulder and elbow complaints. I treated 25 years ago one of my patients at this area for a sinusitis disorder. And so he came and said what I have done with his shoulder, because it had improved so as he had never before. And I didn't know he was one of our German tennis champions. He's still the trainer of Boris Becker now. He was one of the famous men at the time. And he had become many, many injections of cortisone in his shoulder by many famous orthopedic professors all over the world. He was traveling to many, many places, and he just went to the most famous doctors. And just a little injection with some drops of local anesthetic in this area and all his pain in his shoulder complaints disappeared forever. So, why? The question is, why can we do such work here? How can we explain such effects? We know that the wisdom stand is connected with heart and small intestine, and the area behind is connected with lung and large intestine, according to the meridian teaching of acupuncture. So we have all the meridians crossing over the shoulder area. For in the teaching of acupuncture, have ich sie, vielleicht haben wir noch einen Dickdarm da. Es liegt ja noch irgendwo da hinten. Maybe we will find it. If not, doesn't matter. Oder habe ich schon wieder hier? Ja, da kommt er. Der rote. Look once more. We can have it still here. Look once more. This is a large intestine meridian passing the shoulder. You see it? And the small intestine passing the shoulder on the back side. One on the front side, the other on the back side. And if we have points in the oral cavity which correlate with these systems, the system of the large intestine and the system of the small intestine, so we can treat also shoulder elbow complaints. Okay?
Would classic tennis elbow be helped by that?
Yes, you can have a try. I have to say that it doesn't help in every case. It's the same as every kind of treatment we do. It works in some patients wonderful, in other patients it works but not perfect, in other patients it does not work.
Now would that be the tuberosity area?
What's more?
Inject the tuberosity area?
Yes. It's better if you have the injection not only done on one side, but if you do it on either side, right and left side. It's a better. If there's a long-standing disease, and if there are many treatments had been performed, and if you have the feeling there's also a psychological background in the disease, it's better to treat right and left bilaterally. The better effects. So you understand that we can include the meridians in our understanding of what we do in oral acupuncture. So können wir ausmachen. So once more, this area is the most important area to be treated in oral cavity. The upper jaws, wisdom tooth surrounding, is a 9-tooth area according to Vollen Kramer. And think of it to treat all problems of the mucous membranes, problems of the sinuses, problems of the bronchitis, problems of the shoulder complaints, but many problems also of headaches, especially tension headaches, can be treated by this area. And all who are familiar with the TMG treatments, they know that the gnatologists, they use a little finger palpating in this area for the pterygoid muscles. Lateral pterygoid muscle. To feel a little of the tension of the muscle. But what does it help if you just feel it with a finger? Why don't do a little injection to take off the tension, to overcome the tension? And it is done just by a little injection here. So realize that we not only treat according to the Chinese systems of meridians and all the intercorrelations we have become familiar, but just in the simple thinking of muscle tension, we come to a place where the tension of the pterygoid muscles, the lateral pterygoid, can be changed. It can be released just by some little drops of a local anesthetic in this area. And this might be done in all kinds of treatment where the TMG is involved. Well, it is very simple done. It's 2 minutes and you have injected some drops here. I do it. No, no. Once more, this is the area between the upper and the lower wisdom tooth. I call it for the Niemandsland, for this.
No man's land.
No man's land. No man's land. For no dentist, no ENT doctor was interested in this area. No man's land. And this is a wonderful area for treating many, many troubles again, especially also in this 9-tooth area of the lower jaw. In this 9-tooth area, there are correlations to the cervical spine, but not only to the cervical spine, but also to the lumbar spine, to the iliosacral joint, but also to the urogenital system. So we can do a lot by treating this area surrounding the wisdom tooth in the lower jaw. And again, first we have our palpating done. Palpating this area and looking for a painful area, either palpating with a finger or better palpating with a needle, and where the needle causes a very painful symptom that the patient reacts very suddenly, and so we know we have struck the right point. So then we can put the needle at this very spot, very point, and give a little injection, but very superficially, and only 2-3 drops, it's enough. So, to repeat once more, the lower jaw connected especially with the cervical spine, and we have to realize that in many kinds of our treatments, when we do operations, for example, operation with the wisdom teeth, or if we have a bridge to be prepared for many hours, 3-4 hours dentist work, and patients sitting with open mouth and full of tension, full of anxiety. So the neck muscles are full of tension. Orthopedist doctors told me that after a 3 hours treatment with the dentist, many patients come to him to be changed like after, like a whiplash, like a little whiplash trauma. Because you sit in this tension for many, many hours, full of anxiety and the noise of the boring and the vibration of the boring, all this works on the cervical spine. And the cervical spine is traumatized by this, but you can give a release just with a little injection in this area. So I told you the research work at the University of Munich, the study I represented. So we used these points for the cervical spine in this area. Points at the earlobe, points here in this area of the wisdom tooth 9th area, and points at the hand of the 5th finger. So very important area to treat here. This is a photo from a friend of mine, an ENT doctor. He talked about this method at many ENT congresses, and now this picture is in one of einem Lehrbuch, was in a textbook of ENT, a normal textbook. The professor of Berlin University, he edited a new textbook of ENT, and this picture is included with this method. So I think we really can say it's no more say an outstanding medicine, but it's included in our normal medicine to treat cervical spine troubles by this area, points in this area. Reflex points, as we can call it, very near to the tonsils, near the arcus palatinus, but again, this is an area where no dentist, no ENT doctors were interested in. So we have a very good reflex area for many, many troubles that we can treat here. And again, think of the muscles of mastication. Here are the tendons of the temporalis muscle, the tendons and muscle of the masseter. Just giving little injections also releases the tension of our muscles of mastication. And I think it's very important to do. Again, the area in the lower jaw. You see here the wisdom tooth. And this all is the area of the ninth tooth area. And this surrounding nearly the 10th tooth area to be called here. And here the points, the best points for treatment are to be found. Now, let me summarize. There are points adjacent to the teeth. A point near each tooth in the vestibulum near the sulcus. There are another group of points in the surrounding of the wisdom teeth, upper and lower wisdom teeth, and so we can use both groups of teeth. The points in the vestibulum is the sulcus, and the points in the ninth tooth area. If we use acupuncture in the oral cavity, it is proven to be better beginning in this area, beginning in the wisdom tooth area, upper and or lower jaw. Why? We can, by treatment in these areas, in the upper and in the lower jaw, can we extinguish, can we diminish the pain felt before in the mucous membrane near the teeth. For example, I had a painful area at the wisdoms, at the canine tooth, and I treat not at this area, but I treat here near the wisdom teeth. In many cases, the painful area here near the canine teeth disappeared, but not the other way. I cannot treat here in the area of the vestibulum at the sulcus and extinguish pain areas in the wisdom tooth area. So there is a law of priority, a law of priority. So if we can treat, we treat better first in this area, and what is still to be perpetuated in the other area, we can treating later. So beginning is best done here in this area.
A lot of people get angle of jaw pain after dental work with the deep needle in there. Would superficial injections along there prevent that?
No.
Is it that there may be pain after injections?
Yeah, after the nerve block, for dentistry.
Yeah, after nerve block.
Mandibular nerve block.
Right.
Yes.
Some pain.
If there's some pain, you can have a try. But the best is what I told before, give a symmetric injection. You understand? Have a try on the side where you have this nerve problem. You can't help so much with needles or with injections. But you can have a try on the symmetric point, that means on the other side. I've seen cases where it really works. Not in every case, but I've seen fine cases where you could overcome the pain situation just by the symmetric point. But you have to look for the symmetric point very, very exactly. It's not anywhere, but it is just one special spot.
That's usually spasm of the medial pterygoid muscle, and the best treatment for that is fascial release using osteopathic techniques with your finger.
Yeah, I can agree. Okay.
That's the best.
Yeah, you can.
And,
Yeah.
creams on the outside, like
Yeah.
Lipidyral or
Yeah.
Tramino.
And therefore you can combine it wonderful with such. I use with some similar creams, lymphatic creams, using outside here. It works wonderful. So not only use acupuncture, but I like to combine acupuncture with neurotherapy, with such fine creams, for example, for lymphatics and so on, or with bowel therapy for the intestines. Okay. No more questions. This is yes, you understand, iliosacral joint. This is cervical spine, but the area for cervical spine is much larger, and it's here in this picture to be seen. It goes on here to the lingual area and a little more here to the buccal area. The cervical spine is the largest area. And this is lumbar spine. Lumbar spine outside, and the buccal area of the wisdom tooth, sometimes also of the seventh tooth, beginning here in this area. Patient coming with lumbar pain syndromes, palpating in this area here, buccally of the molar teeth. If there's pain, then palpating on just the side where the pain is also in the lumbar region. So you can treat in this area, and in many cases it will help. But if there is no pain to be palpated, not with a finger, not with a needle, it's better to have another treatment. It's the earlobe or at the hand or other points. So just by palpating with hand and with needle, you can see which is the chance for treatment. If the points are very sensitive, there's a good chance for treatment. If they're not at all sensitive, if there's no sensitive area in the mouth, in the oral cavity, so it's better you do your treatment at other places. Yeah, this is the last thing. So you see, sometimes we use points more lingually. If you think that might be a ninth tooth, a fictive ninth tooth, so it's nearly as if we would give an injection to the root, to the apex, lingually. It's the same as we do as ENT doctors for tonsillectomies. We have injection in this area. So sometimes we go a little more lingually for meeting points for the cervical spine and for the iliosacral joint. That's very simply to be done. Only the tongue is a problem, but no other problems. After injecting some drops, we used to palpate the area to disperse the little bubble which has come up, and to control, to have a checkup if the pain in this area has gone. If you use such a checkup, it's very important that we use a very low percentage local anesthetic. If I use a 2% or 1% local anesthetic, the pain is gone in every case. It's no problem. But I like to use 0 to 5% local anesthetic and give only 1 or 2 drops, so that just a very, very small area is no more is sensitized. But you can feel in the adjacent area still, here's pain, and so you know, this where the needle has been stuck, here it's gone. But the area near is still sensitive when palpating, so you know where it is. If you have a 1 or 2% local anesthetic, all this area would be desensitized. Yes. Okay. This is very difficult to explain, for that means that in this area, distally of the wisdom tooth, upper wisdom tooth, lower wisdom tooth, all the meridians we are familiar in normal acupuncture, liver and intestine and lung meridian and gallbladder meridian and kidney meridian, all are to be found in this area once more. So we have the meridians once in the vestibulum area, and I will give you a chart of it. Each one will get it. So we have all the meridians of acupuncture in this area. But once more, we have the meridians in the area distally of the wisdom tooth. So lots of points are to be found in the oral cavity. We don't use points here inside in the palatum. So I have not experienced this. I'm sure there were points to be found, many points maybe. But patients don't like to be stuck in this area. So it's better to do it here in the vestibulum near the sulcus. And in this area, it's not so painful. If you use the technique not to open so widely the mouth, but before I give the injection, I say to the patient, please close the mouth a little more and a little more. And so the muscle tension is gone. And so you can do the injection